Well, it's all politics, and it's all profits for the pharmaceutical companies. And you realize the pharmaceutical companies are pumping tens of millions of dollars to these politicians, and Perry's a good example. He's been promised $50 million for his presidential bid by these pharmaceutical companies. He's gotten over $1.5 million funneled through backdoor for himself, and his chief of staff, in fact, has made sure that he's gotten the influence of Merck Pharmaceutical throughout the whole political structure. So, yes, this is pure politics, but it's being paid for by the pharmaceutical companies big time. They're huge money. They have huge influence. We're talking about billions of dollars in the sales of these vaccines if they're made mandatory. Now, you'll notice every time these pharmaceutical company reps or these politicians or the CDC talks about the high death rate from cervical cancer, they never talk about in the United States. It's always in the world. Well, we know in undeveloped third world nations, cervical cancer is a killer because they don't get pap smears. They have poor hygiene. They have poor dietary intake. They have immune deficiencies. And so, of course, they have it. But in the United States, it's extremely rare, very rare, easily controlled, 100% cure rate of the early detected cervical cancer, 100% cure rate. And we know that just by supplying a few vitamins, you can dramatically reduce the incidence of infection by HPV and cervical cancer. And even that many of these cases of the dysplasia of the cervix, that is, the precancerous changes, will revert back to normal in the presence of giving folic acid and vitamin B12. Now, all of this is well demonstrated. But they cover this up because they're trying to sell vaccines, and the politicians want these donations from these pharmaceutical companies for their political careers.
Now, we've seen a lot of the victims go on television. There's been a lot of CBS reports and other things about the paralysis and the seizures that have happened. What about the face of those victims? Why is everything focused on Rick Perry, who's running for higher office, and how he's now sorry all these years later about mandating this vaccine, which of course had effects in other states, other parts of the world?
Well, again, this is what we're saying is all of these victims have no voice. The media really doesn't want to talk to them because pharmaceutical companies advertise heavily on all the major media. And so they don't want to lose that advertising dollar from these big pharmaceutical companies. So they try to play this down and act like, well, we just don't know if there's any connection between the vaccine. Well, you take an 11-year-old healthy girl, you vaccinate her, and within weeks she dies, or days she dies, and this happens hundreds of times. Well, what do you think made her die? A mysterious ray from outer space? And it's ironic that in countries like India, they had one death from the vaccine and they banned it. They had sense enough to say, we got a problem here. But in the United States, there's so much money being passed around to the media through the CDC, which has a strong connection to the pharmaceutical makers. All of this is covered up. And these, if you've ever watched the mothers and looked at these daughters, which I've seen a number of them, these girls are destroyed. I mean, their lives are ruined. Some of them are wheelchair bound. Some of them are hospital bed bound, having repeated seizures many times a day, uncontrollable seizures, can no longer go to school, have no future. All of this with this idea that we're preventing cervical cancer when, in fact, there's much safer ways to prevent cervical cancer, and the risk from this virus is far less than we're being told. And these mothers have been, I've had mothers tell me they went to the pediatrician's office and he told them, if your daughter does not get this vaccine, she's going to get cervical cancer. Now, that doctor should be charged with malpractice because that's an absolute lie. There's no evidence for that whatsoever. And there's a massive amount of evidence that says that's not true. That girl's chance, of all women in the United States, chance of getting cervical cancer is less than 1%. It's about 0.26% chance that they will ever develop cervical cancer. Now, if she walked in the office and said, well, your daughter has a 99.8% chance that she'll never develop cervical cancer, how many would get the vaccine? And so they turn it around and say, oh, gee, there's a huge connection between HPV vaccine and cervical cancer, when in fact that's not what the research says at all. That even when you're infected, the risk of you developing cervical cancer is extremely small, particularly if you don't smoke and you have a good diet and good hygiene and get regular pap smears. Your risk of developing cervical cancer is essentially nil.
And now they're pushing it on boys too. But we know we have this regulatory problem with the FDA and the CDC and the revolving door structure with the big pharma industry. How do concerned citizens fight back against this? How do we take back our lives and inject reasonable opposition to these dangerous vaccine promotions?
Well, people need to do the research, number one, and with the internet, it's fairly easy. You can get on there and get these articles which show the research that's been done on HPV, the relationship to cervical cancer. You can look it up yourself. You can get on these sites where a number of mothers have started sites who've lost their daughter to this vaccine, telling these stories, showing the videotapes, connecting with other mothers that have gone through this horror. So it takes a lot of research. You need to do this before you just walk in there and have your daughter vaccinated. This is one of the most critical decisions you'll make, and it's irreversible. This is what I tell mothers. I said, when this is done and your daughter's crippled and having seizures and her life is ruined, it's hard to turn that around. This is a life and death decision that mother has to make, and you shouldn't allow these physicians who are just using the data from the pharmaceutical companies. They're not using it from the research literature and what we know clinically about this disease. They're using information from their societies, which are in the pocket of the pharmaceutical companies, like American Academy of Pediatrics, and the CDC. You know, I have a scientist friend of mine that's been to the CDC numerous times, and they said you walk down the hall, the walls are just plastered with posters that were given to them by the pharmaceutical representatives, and it's extolling the virtues and safety of vaccines, and they're all printed these beautiful color posters by the pharmaceutical makers, and this is in the CDC, which is supposed to be independent. Well, they're not independent. They're supported by heavily by the pharmaceutical companies to promote these things when they know it's a lie.
It's incredible, Doctor. Well, thank you so much for joining us, and we're going to turn now to other issues. Thank you and goodbye. And, well, that was Dr. Russell Blaylock, and he's right. It's all on record. You can look it up for yourself. The ties between industry and government are absolutely obscene, and the way they're promoting vaccines is very dangerous. So I hope people are going to take the time to look it up and realize that it takes a toll. I also hope you'll consider subscribing to the InfoWars Nightly News. We're just getting started. We're about to be bigger and badder than ever. We've hired all new reporters, and we're about to add even more people to the team. Alex is going to be back tomorrow, Tuesday, September 20th, and he's ready to rock and roll, I guarantee you. It's been an honor to sit in. I'm Aaron Dykes, and till tomorrow, this is the InfoWars Nightly News.